Today, Dr. John looks at low back pain and sciatica, part 1. Let me move the skeleton into place. Here's our skeleton. Let's adjust the camera. There's our skeleton. Let's get the skeleton a bit closer. We're looking at the skeleton and we're looking at low back pain. So here's the lumbar vertebrae here, and there's 5 lumbar vertebrae. How many are in the chest? Okay, in the chest there's 12 vertebrae in the chest. You could call them chest vertebrae, or we call them thoracic vertebrae. Thoracic means in the chest. So 12 vertebrae in the chest and 12 ribs. Each rib attaches to the back of the vertebrae. And then each rib comes around, joins a cartilage, and the breastbone's in the middle. These ribs protect the heart, they protect the lungs, and as they move up and down, they expand the lungs. And the kidneys are down here, partly protected by the bottom ribs as well. These last ribs don't attach to the cartilages. So we've got 5 lumbar vertebrae here, and if you look at the body, there isn't much holding the upper part up except these last 3 vertebrae here. So these ones are under a fair amount of pressure. You can see the vertebrae lighting up. So if you get a model like this and point at the disc, you can see it lighting up like a neon sign. Here's the nerves coming out. 1, 2, 3, 4, and 5. The bottom part here is called the sacrum. This is a sacroiliac joint here. You can see an arch here and a notch here, and that's where a large part of the sciatic nerve goes down here and then down the leg. The lower lumbar nerves here tend to go down to the bottom of the leg. Mid-lumbar nerves tend to go on the middle part of the leg, and the upper nerves here tend to affect the upper part of the leg, both as far as the skin and the muscles go. The sacral vertebrae here have some nerves coming out. A little bit hard to judge where they are, but they will affect the bottom of the foot and some of the nerves in that area. Let's look at where the nerves can go. We'll hold up our sign here. There's the let's just bring it over here. So there we're looking at lumbar 1, 2, 3, 4, 5. And sacral 1. So you can see how these describe how the nerves are attached to the skin. These don't describe how they're attached to muscles, but you can sort of see the lower down you get, the more they're likely to affect muscles and sensation in the lower leg, and up here more likely to affect muscles and sensation in the upper leg. Let's look at another description of the leg. Here we see lumbar 3. Let's assume at number 3 the nerve was suddenly cut, or that there was some unusual wound, like a stab wound or bullet wound, suddenly cut lumbar 3. You might feel a lot of pain, and suddenly this area will go numb. Why doesn't it extend more? It's because there's overlap from other nerves. So lumbar 2 overlaps a bit, lumbar 4 overlaps a little bit. Let's see, there's lumbar 4, sudden transection of lumbar 4, suddenly cutting lumbar 4 nerve. You get a numb area there on the left leg. This is at the front on the left leg. Lumbar 5, suddenly cutting that nerve, or a sudden herniation of a disc there and down here, and on the bottom of the foot there'll be a little bit as well. So this is how the nerves work. The spinal cord, which is a giant nerve coming out of the brain, ends about lumbar 2 here. All the other nerves behind here are not part of the spinal cord, and they can regenerate if pressure is taken off them. We'll discuss in further elements, number 2 and number 3, what happens when these nerves are under compression. This is Dr. John, over and out on low back pain and sciatica number 1.